Thank you, Presiding Officer. Today, Scotland's nurses have spoken. This damning report from the Royal College of Nursing lays bare our broken NHS. First-hand accounts from over 500 Scottish nurses reveal a lack of dignity and privacy for patients stuck in corridors and side rooms. They describe scenes of chaos, patient safety being compromised due to a shortage of beds and a dangerous lack of medication and oxygen. It's page after page of shocking and desperate testimony. One said it's degrading, undignified and at times unsafe for patients who are already angry due to the long waits, sometimes waiting in emergency departments for over 35 hours to go to a ward just to be put up in the corridor. The system is broken. So does John Swinney agree with Scotland's nurses that Scotland's NHS is broken?
First Minister.
The first thing I want to do is to apologise to any individual who has had an unsatisfactory experience in the care that they have received and in the congestion within the hospitals. I want to commend, as I did last week, the staff of the National Health Service for the unremitting commitment that they give to ensure that the system is able to deliver as best as it can in the face of unprecedented demand. And I recounted to Parliament last week the enormity of the increase in flu cases that have been wrestled with within the National Health Service over the course of the last few weeks. The Government is entirely focused on ensuring that we meet the needs of patients and we support staff in undertaking the essential work that they undertake, given the enormous increase in demand that we faced in recent weeks.
Russell Findlay.
Thank you. And while apologies are welcome and commending staff is also welcome, it's change that's required. This report confirms that hospital overcrowding is at dangerous levels, with one nurse saying, "I work in what is supposed to be a 32-bed assessment unit. Recently, we've had between 60 to 70 patients at any one time, and we know the root cause of this. It's due to record levels of delayed discharge, which the SNP government promised to eradicate 10 years ago. 10 years ago. But SNP ministers now don't even seem to accept this reality. This morning, the Health Secretary denied that patients were regularly treated in corridors, and in response, Colin Pullman of the RCN disagreed, saying it's now been normalised. So, First Minister, who is right, Scotland's nurses or the SNP Health Secretary?
First Minister.
President, the Health Secretary and I are fully aware of the circumstances that are prevailing in our hospital system just now. The Health Secretary has seen it with his own eyes in the visits that he has undertaken. I saw it when I spent the evening of the 4th of January in the emergency department of Edinburgh Royal Infirmary, where I was observing the enormous commitment of staff in the face of unprecedented demand. And I remind Parliament that the level of flu cases that we have been experiencing and the level of hospital admissions are the highest they have been since records began in 2010, and they are formidably higher than the demand that we faced in the winter of last year. So there is unprecedented demand in the system. I want to commend health service staff for managing through those difficult experiences, and of course the measures that the Government has put in place to tackle delayed discharge, to ensure we have better flow navigation within our hospitals, to make sure we have same-day treatment services available, are all part of the measures the Health Secretary has taken to try to address this situation.
Russell Findlay.
The fact the Health Secretary has seen it with his own eyes and then continues to deny it is absolutely damning. But it illustrates a stark disconnect between what SNP politicians think about the NHS and the reality of what the nurses are actually saying. So here's a reality check. Some nurses are being forced to quit in desperation and disgust. A nurse of 10-year service said, "People are dying as a result of ambulances being held at hospitals." Another said, "It's disgusting and we're on our knees, but nothing seems to be getting done." Another said, "It breaks my heart at the pathetic care that we are able to give." It cannot continue. It's absolutely heartbreaking. So when will this Government bring forward a serious plan to fix Scotland's NHS?
First Minister.
Presiding Officer, I want to assure Parliament that despite the enormous increase in flu cases that we have seen, to the highest level we've ever seen on record, there is now a reduction in those cases prevailing within the National Health Service. I also want to assure patients of the steps the Government has taken to ensure that we have the support in place to address this demand, which comes from, as I said in my earlier answer, the same-day emergency care services, the provision of flow navigation centres, the provision of frailty units in hospitals, the development of the hospital-at-home system, which has significantly enhanced our ability to care for patients and to ensure that individuals are supported in the right context and in the right circumstances. Now, Mr Findlay asked me about reforms. And reforms were undertaken in the redesign of urgent care programme in December 2020. And the independent evaluation of that programme has demonstrated that the patient experience from the redesign of urgent care has resulted in, for many patients, shorter waits as a consequence of the expansion of emergency care that we've put in place,
Members.
and also the expansion of NHS 24 services that we have put in place, which was a key recommendation of the redesign of urgent care. Now, what has helped us in this incredibly difficult period has been the fact that members of the public have followed the advice that the Government has issued, which is to secure the right care in the right place, which means that that has reduced the amount of demand that is prevalent in some emergency settings and has enabled us to provide the support that individuals require. That is what we have to do to navigate through the periods where there will be increased demand, and that is one of the periods that we've just experienced.
Russell Findlay.
I really don't know where to begin with that answer. I mean, this covers a period where the flu epidemic that we're facing now is not in action. It's absolutely preposterous. Patients expect and deserve dignity and decency from the NHS, but nurses say they cannot provide the treatment that's needed. And I'd like the First Minister to please just listen to what the nurses are saying. I've read the report and I would encourage him to do so. One describes being disgusted and ashamed that this was the best we could offer a 91-year-old lady. Another describes being embarrassed and ashamed at leaving a 100-year-old woman on a trolley in discomfort. Another said, "We are putting Scottish Government targets before patients and it needs to stop." So what does John Swinney have to say to those nurses who are being let down and to the patients who are having to suffer this disgusting and degrading treatment?
First Minister.
Presiding Officer, the reason why I cited the flu rates is because that was they were at their peak, putting the greatest burden on emergency care within the National Health Service during the period that the RCN survey was undertaken. So the evidence that I've put to Parliament is directly related to the questions that Mr Findlay is putting to me. Now, I accept and acknowledge the enormity of the pressure on the National Health Service. I have been completely candid with Parliament about that over a number of weeks. And as a consequence, we have been leading a process of supporting our territorial boards, supporting the Scottish Ambulance Service. In the review call last night, which I chaired, there is a significant improvement in the delivery of healthcare in emergency situations as a consequence of the reduction in the flu cases that I have talked about. And I am grateful to members of the public for their cooperation in trying to ensure that they secure the right care in the right place. And I'm profoundly grateful to staff for working so hard during an incredibly difficult and demanding period. And Mr Findlay asks what the public can expect of the Government. Well, what the public can expect from me is the unrelenting focus of the First Minister, working with the Health Secretary to make sure we deliver the improvements and the developments that will ensure patients get the care they require and to ensure that they are supported in having the care that's necessary to address their health circumstances at all times.